We're here for launching the iSikCure, and the reason why we're also here again is to be able to have the public know what iSikCure is also all about, and also engaging the public to let them know as well that this is a product that is coming into the healthcare system and is going to be able to have a change.
We set ourselves on a huge, on a significant path to say, can we enable every household to have a level playing field when they are sick? That is, how can you find a convenient way to know where a doctor is, to know what medications you have, and how to pay for healthcare.
When I'm driving, what am I thinking? One, the hospitals are closed. My colleagues are on strike. Where do I get this child to? Convenience. I don't care the price, but convenience is important. The quality. All of us here who have a child, all parents in Kenya there who have a child, they know you cannot afford to take chances with your child.
Basically, we are in a system whereby healthcare is being driven by word of mouth, uncertainty, and credit. But then what if now you say, okay, well, I know where to find care, you know the clinic, usually you default to the one in your neighborhood, or depending on your socio-demographic, you say, well, I'm going to go to this big name hospital where I know the specialist, and that is fine. And when you get there, you meet the doctor, but you cannot pay for healthcare. What happens at that moment?
There are three initiatives now going in Kenya. One of them is iSikCure. iSikCure started since 2 years back. We started the idea with a local team of Sagittarius company, which is Nairobi-based company. So through a long process, we select and support a broad base of social innovation, and iSikCure was one of them.
I can say it's a new dawn, it's a new day. It is a whole new experience we're trying to build for the customer, for the patients, and to say that if you have iSikCure, then the journey should be a very different journey. So first and foremost, you can find the doctor, you click and you can find by name, or you can put fever. I just have fever, and it will match with the provider's profile. And you take you to the provider's page, you can see where they train, you can see what they do, you can even see their passion. You now can also track your symptoms, and you put in, I'm not feeling well, I have back pain, and it stores it, and you have your information being stored.
You're able to make a decision because the providers will have on iSikCure. You can be sure that they are legitimate and they are qualified. So the issue of trust is right there on your hand. The issue of convenience, because your phone is always with you. And if you don't have a phone, you can borrow one.
You want to pay by cash, that's fine, absolutely do that. Or you can use your credit card, absolutely do that. Or you can use mobile money, M-Pesa, what have you, absolutely do that. But most people, or if you have insurance as well, at some point, as we grow the application in the market, you can also use your insurance, once as we establish relationships with insurers. Another way to pay for services is to say, 10 of us, we are friends, we can form a group, and then on the platform now we can cost share. So if any of us is sick, we can cover our expenses up to 3,000, 4,000, 5,000 shillings without any undue pressure on each and every one of us.
It keeps out the quacks. It keeps out illegal pharmacies that offer drugs that of unknown quality.
By creating your profile, you earn points. By enrolling your dependents, you earn points. What we're in essence saying in a nutshell is that if you're doing the right thing, adhering to your treatment, promoting health in your community, you deserve a break.
This is the way to keep our community safe, by linking all the providers, the clients who need care, the doctors, the other clinicians who are providing legitimate business who are qualified, and the suppliers of pharmaceutical.
On iSikCure prevention for chronic conditions, you're diabetic, you're a hypertensive patient, you're adhering to your treatment, tracking your medicines every day, you would get a better outcome.
iSikCure today will provide the 5 A's. It gives awareness for the patient, it gives acceptance through e-health, it's provide affordable prices for every part in healthcare, either drugs, either consultation and other parts, and also availability as distribution and availability of quality drugs for the patient. So through the 4 A's, we will achieve accessible patient to the right medication, to the right health care system.
And that's the kind of change we want to see happen, such that, you know, the Mwananchi are not paying the price for healthcare more than anybody else, because they are the ones paying the price, because they pay for everything out of pocket. To be part of the new, the future of healthcare that says, basically, with our mobile phones, with a solution, we can pretty much start trusting ourselves a lot more when we are looking for healthcare. And we would even ask our doctors to download iSikCure, because it's a convenient way for yourself and your provider to be in contact. It's a convenient way for yourself and a trusted pharmacist to be in contact. It's a trusted way for yourself and your employees and your employer, to be in contact with each other, so they can help you for